what are the types of bariatric surgery? Bariatric surgeries can be essentially classified into two varieties. Basically, you have restrictive procedures and malabsorptive procedures. Restrictive procedures, basically you have procedures like sleeve gastrectomy and a laparoscopic band applied. So, and of course nowadays we are doing the endoscopic sleeve gastrectomy in patients who are not fit or willing for regular sleeve gastrectomy, which leads to about 10 to 15% of weight loss. In these restrictive procedures, by whatever way, by laparoscopy or putting the band, we are actually reducing the size of the stomach into a 30 to 50 ml pouch. Because the stomach is a 30 to 50 ml pouch, the fundus of the stomach, which produces the ghrelin, which is the hunger hormone, that levels are reduced, as well as because of the small size of the stomach, the food capacity is reduced, the food eating capacity is reduced, early satiety occurs, and because of the intake is reduced, and also the hunger is reduced because of the ghrelin, and because the food is getting emptied rapidly into the intestine, the incretins, the peptide YY, GLP, those hormone levels are also improved, helping in glycemic control and regulating the fat deposition. So that's how the restrictive surgeries work, be it sleeve gastrectomy, lap band, or endoscopic sleeve gastrectomy. Then you have the malabsorptive surgeries. In these surgeries, basically we make the stomach into a small pouch, into a 30 to sometimes not 50, so 30 to 60 ml pouch, and also bypass some intestine. Like about it can vary from 100 to 200 centimeters of intestine is bypassed, so that the patient not just eats less, but also because some of the intestine is bypassed, they absorb less, so the food absorption is also less. So this is basically the gastric bypass surgeries. You have the most popular include the Roux-en-Y gastric bypass, then the mini gastric bypass. There are other more complex bypass surgeries for super obese. We don't need to discuss them now, but essentially the commonest bypass surgeries we do are the Roux-en-Y gastric bypass and the mini gastric bypass. So the difference between sleeve and one type of surgery is the restrictive like sleeve, and malabsorptive like bypasses. The malabsorptive surgeries like gastric bypass, RYGB, are more powerful surgeries. So in sleeve, the weight loss stabilizes by 8 months, and after 2 years there is some chance of weight regain if the patient doesn't follow a very disciplined diet and lifestyle. But with the malabsorptive surgeries, the weight loss is generally, once it goes down, it never goes up unless the patient is consuming a lot of alcohol, a lot of sweets. Most of the time, even if the patient doesn't follow a very strict exercise and dietary regimen, the weight regain is not much. The disadvantage of so any more powerful surgery, better weight loss, more durable weight loss. But the disadvantage of malabsorptive surgery is because some amount of intestine is bypassed, some important nutrients are not very well absorbed. So patients who have had a bypass, depending on what level of bypass, they would require additional iron, calcium, protein supplements. These are especially important in the first 5 years post bariatric surgery, but preferably should be taken long term also. So both surgeries have their pros and cons. Sleeve, effective but less effective surgery, and results tend to plateau after 2 years. Gastric bypass, more powerful, more effective surgery, but more risk of nutrition deficiencies. So the patient needs protein and iron and calcium and sometimes vitamin B12 supplements.